psychiatrist Dr. Annel Martinez, here to talk to us about border personality disorder. Good morning, Doc.
Good morning. Thanks for having me.
Good morning.
Thank you so much for joining us this morning. So it is the month of May, which is Mental Health Awareness Month. And we've been having this conversation, Isani, about mental health and so forth, and different ways that we can detect persons and help persons with particular disorders. Today we're talking about borderline personality disorder. Doc, can you help me with a definition, if you will, about this disorder?
So borderline personality disorder is in a group of other personality disorder, which would fall under cluster B. And it is characterized by a pervasive sense of instability and impulsivity. And when we talk about instability, we're looking at relationships, emotions, behavior, and self-image. I think the self-image part is one of the aspects which stand out the most, because they seem to be these people who are not certain of who they are, and they turn into this kind of chameleon where they take on the persona of whatever they believe the environment requires of them. And impulsivity in terms of very impulsive behavior as it relates to sex and promiscuity, substance abuse, spending. And it's also very common where we see this having a comorbidity with eating disorders. And so it's a very complex disorder, and the way how borderline even came about is in early days of psychoanalysis, where the patients who were in therapy weren't improving at all. And what the psychoanalysis would see is that they're kind of on the borderline of neurosis or psychosis. Neurosis being anything that's affective, depression, anxiety, and psychosis being losing touch with reality. And so they weren't on either end of those spectrum, and so that's how the term borderline came about.
The first time I heard about this disorder, I was watching a TV show called My Crazy Ex-Girlfriend. And I know that it was one of these nuances. All of the personality traits that you have describing this one individual had. And she was under the clear impression she was taking antidepressants because this is what her therapist had recommended to her. She was diagnosed as anxiety and depressed, with anxiety, and depression. And so how do we detect this type of disorder? Because clearly it can be misdiagnosed if you don't catch it properly.
Agreed. And it's interesting how you came across the term borderline. And for short, we also call it BPD, which is going to be easier for me to use going forward.
Yeah.
There's such a huge misconception or stigmatization of what BPD is because of how they're painted. I think even the title of the show that you were watching, Ex-Girlfriend, Crazy Ex.
Yeah.
This image of someone who will go slash your tires,
Yes.
key up your car, mash up your
Many of those.
windshield, and then in the same breath also telling you how much they love you and
Yes.
and you can't be out of their life, they can't live without you, and you're the reason for living, right? And I guess we'll go back to the definition where it says that emotional instability, where they experience emotions, whether positive or negative, in such an intense way. Kind of if I lose somebody and I do not have BPD, I might go through some level of grief. And I'm not talking about loss to death. I mean, somebody walks out my life, whether that's a friendship, I'm cutting off ties, or I was cut off by a family member, or somebody in a relationship. For me, it'll hurt, but it's not going to affect my integrity as a person. I'm able to separate myself from the other, and I will recognize that, okay, well, I lost that person. It doesn't mean that I'm a crappy person, or because that person is out of my life that I'm unlovable. However, the thought of a person with BPD is that because they've been abandoned, it means nobody loves them. And that is true to them regardless of how many other people are in their lives who might still be very supportive and very loving towards them, right? In psychiatry, psychology, we use the DSM, and I think the latest version of the DSM is the DSM-5. Within the DSM, to be able to diagnose and separate from what would be anxiety, depression, eating disorders, and whatever other comorbidity might exist with borderline personality disorder, they have 9 specific criteria. They try not to make it categorical and look at the person in a more holistic way. So we're looking at relationships, emotion, behavior, identity, right? And if you'd like, I could go over those 9 criterias that we would have to go through to be able to diagnose somebody. There's a lot of misdiagnosis because of how many other symptoms present within the context of this one disorder.
It's interesting because when we talk about borderline personality disorder and the overall issue of mental health, right? Oftentimes we encounter persons who perhaps exhibit these very symptoms and we don't necessarily know what it is or how to treat with it in terms of our interactions with these individuals. In your profession as someone who's trained to be able to readily identify these symptoms, if I could use that description, what do you look for specifically, Doc?
All right, so majority of people who come into treatment for BPD don't come in telling you, I have BPD, or they even suspect they have BPD. A lot of them come in first time for anxiety. Again, going back to that emotional distress that they experience and how much more intensely they experience emotions than the average person does, right? So they would come in for severe anxiety, severe depressive symptoms, eating disorders, drug or substance abuse disorders. And what we would see in these patients is that there is a fear of abandonment. And this could be fear of perceived fear of abandonment, or it could be real or perceived abandonment in the sense that, what if I say something wrong and they don't think I'm interested? What if I don't show up because I'm extremely tired and they stop talking to me? You know? And so everything they do really is geared to making sure that they will maintain the affection of whichever person they feel is important in their lives. And a lot of what they do or how they behave end up causing that same abandonment that they were trying to avoid in the first place. Why? Because they're so intense. If I feel that you not saying I love you at the end of our phone conversation means that you no longer love me, I'm not going to be content. So you hang up and I'm there thinking, oh my goodness, this person is so over me. I don't know what my life is going to look like. I don't know what's going to happen to me next. I don't think anybody else is going to love me. So what do? I blow up your phone. We just had a conversation, so you don't pick up. Or maybe you walked away because you're busy. But I'm there texting. You're not reading my text. You're not responding in 2 seconds. So I'm calling. And if you don't pick up, then anger, rage comes up. Shame comes up for them a lot. So then they start treating that person as if though that person has actually abandoned them. Now, if on the other end, you don't quite understand what's going on, you will also want to defend yourself. And when you defend yourself or you start to pull away because it's just too intense for you, then that person is abandoned indeed, right? And we always see these people who tend to be manipulative in our eyes. This is external, right? They lie a lot over the simplest of things. And mostly it's because you're trying to avoid the consequence of being abandoned. And other things would be that they have such inappropriate response to emotional situation because of how low their tolerance is for distress. Another thing that we see a lot is also self-harm behaviors, self-injurious behaviors, or a lot of attempted suicide. Again, because of the intensity of their sadness, their desperation. They tend to want to check out a lot. And so you might have this depressed person who started with early life depression, preteen or early adulthood, several suicide attempts. And you will notice too that the suicide attempts are going to be kind of on the mild side. They don't do anything too fatal.
Mm-hmm.
Or you notice that when the self-injurious behaviors happen, it'll be very superficial cuts or burns or other things like that. So these are the key things that we look for beyond the anxiety, beyond the depression.
Doc, what happens, because you are a psychiatrist, so you are trained to diagnose and treat. And so I'm very curious to know what happens in that person's brain for these different things to be occurring, and then how do you in your profession treat this type of disorder?
Very well. So neurobiologically, we have noticed that there are several chemical and structural changes that are also shown within the persons with BPD. Curious thing about how it comes up, really and truly, there are only theories, and we use the nature and nurture theory of how this comes to be. There is a high incidence of hereditary component in BPD, and also a big part of it is the environment. Because if you have parents who also have BPD, then there will not be a emotionally nurturing environment for you to grow up in.
Mm-hmm.
And that increases your risk factor. What we have seen biologically is changes in brain structures like the amygdala, our fear center. The fear center in BPD patients is actually smaller, which means it is dysregulated because it has not developed adequately as it would in a normal person. We notice that their stress response system is also hyperactive. So very minimal cues will trigger a very intense fear response in them. Among other more complicated changes that you see, in the chemical aspect, we will see that there is also huge imbalance in their serotonin levels, dopamine levels, which are your neurotransmitters. Your neurotransmitters help your brain to communicate, process, and then respond to information from the external world. So as I said, it's very complex. And even though a lot of people might say, okay, it's a personality disorder, you want to be like that because that's your personality. Not necessarily. There is so many underlying problems or challenges, including trauma, early childhood trauma, which could then influence how someone develops borderline personality disorder, which also cannot be diagnosed in a person if they are less than 18 years of age. Because in early adolescence, your personality is still forming, it's not consolidated. So it wouldn't be fair for us to put the diagnosis on someone who is less than 18 years old.
Wow.
That's interesting.
We're here, we have these different conversations often, and I think that it kind of makes you think now about certain situations that you've been, certain personalities, no pun intended, that you've encountered where, as somebody in society, where this could be your friend. How can I help? What do I do?
So, even though most psychiatrists might treat BPD from a pharmacological aspect, because there are also neurochemical and changes within it, medication helps. It goes a long way to try to reduce the intensity of the emotional experience and the cognitive symptoms to the point where someone can easily relate to the reality or engage with their environment in a way where therapy, which is the treatment of excellence, can work for that person. Because if I'm still in a fearful situation, I'm still highly anxious, I'm still severely depressed, it's not going to be easy for me to sit in therapy for an hour, take my coping skills, take my homework to be able to do it in between therapy sessions. And by excellence, the therapy that has been used in patients with BPD is DBT, which is dialectical behavior therapy. Dialectical behavior therapy is a combination of what we know as cognitive behavioral therapy and Zen Buddhism. So there's a lot of meditative practice in this type of treatment. And the person who actually came up with DBT treatment was a patient herself. She was diagnosed with BPD in early adulthood, and she was in hospital receiving treatment for up to 2 years prior to being discharged. So this is how severe the symptoms can be. And it's not to make any less of other psychiatric diagnoses, but this is very, I guess the prevalence of BPD is higher than we want to think.
Yeah.
The good part about it is it has very good prognosis if we are able to access proper treatment for BPD. The issue or the boundary is the cost of treatment.
Yeah, that's always
Because people who do DBT, for it to be effective as it was planned to be, they have to do some level of intense treatment for at least the first month. What would this look like? A day hospital, where you go to the hospital all day, you're doing group therapy, individual therapy, and then you go home and you sleep and you come back again in the morning. And then you have your individual sessions at least twice weekly for the initial part of it, and it could mean therapy for the rest of your life because you will encounter different situations, and in each new situation you have to develop new coping skills. So again, very complex, and it's not a one person job. It's really important to have a great support system. If you approach a person and tell them they have DBT and they have BPD and they have to go into therapy, it's not likely that they will want to. So what is best for family members, loved ones, and friends to do? Look at the symptom that is most bothersome for them. If that is the depression, if that is the anxiety, if that is difficulty with sleep, but never go to the social aspect where it's like, you know what, none of your relationships work out because you're all over the place. Nobody's going to listen to you. They're going to feel more judged, and they're going to feel like you're abandoning them. So go more to appeal to the symptoms that's bothersome for them and encourage them to seek help.
Wow.
But therapy.
got it.
Doc, as we are wrapping up our segment, I would like for you to just for briefly talk about Psyche and the services that you are offering currently.
Very well. So Psyche Mental Health Services is a private practice located in Belmopan. We're on number 12 McFadden Street. And what we offer is mostly psychiatric services and psychotherapy, medication management. So we diagnose and treat mental illness at different severity and different level of functioning of a person.
Thank you so much, Doc, for zooming by. This was a very interesting conversation. It kind of makes you think, yes, very informative. It makes you think about how different personalities are shaped within our society, especially in Belize, where it's still taboo. I don't know why. It's still taboo to talk about mental health. So thank you so much for dropping by, Doc. We hope that you come back very soon.
Thank you so much for having me. You guys have a good day.
All right. We are about to wrap things up by taking our final break. We'll be right back.